on with us. So for those of you who are joining us live from throughout the world, I want to welcome you as well. Those of you who are local and you want to catch us on the World Wide Web, you can go to my website, which is ASKDRFERGUSON and .com. Right on the center of the page, you'll see a link that says Live Radio Program. If you click on that, that will take you to YouTube. When you get to the YouTube, there's a little house in the upper right-hand corner. Click on that and then click on Feed, and you'll be able to catch us live.
Live and in color.
Live and in color, so not only live on the radio locally, but live internationally. You know, the World Wide Web, for those of you who don't do much on the computer, that's what it is. It's a World Wide Web. So anywhere in the world, you could pick up this presentation. And for those of you who don't catch it live, you can it will stay on the site. You can go by and catch it as a rerun, so to speak.
In case something they didn't quite understand, and go back later, they can
exactly.
Didn't quite hear.
Exactly. They can go back later and pick up on some of those tips they didn't get while we were on the air.
And again, we do encourage the listeners to call in.
Absolutely. You know, that's always good. Call in, and if you don't call in, you know, so many times people see me in the streets and they tell me that they enjoy the program. And I said, well, call in, you know, let us know what you like or what you want us to talk about differently. And they say, oh, I don't want to call in because I might miss something. so I think it varies a lot. Now, you know, my wife has a program that follows us, and I think she does get quite a few call-ins. And so for those of you who are enjoying her program, that's great. Don't forget to tell other people about Talk Back Now, which is her live program she does on political issues. But from what I'm hearing, people are really enjoying it.
And starting next year, be on 3 days a week.
3 days a week, so that's wonderful. So all of you who enjoy my program, I encourage you also to catch her program. It's a very, very different. Mine's on preventive health and what can we do to be healthy. Hers is on being healthy on the political realm and stamping out poverty, which is one of her big themes.
And both are very, very important in our own respect.
Absolutely. And this has another plug. Don't forget she's got a book out. It's called Bookends. It's called Poverty and Politics, and that's available at all your major bookstores. So you go to Barnes & Nobles or Amazon or anywhere you buy a book, and go there and support her and get one of those books. It's called Bookends, Poverty and Politics by Patricia.
I've got to say, like you, she is a busy lady.
Yeah, she's on the go. Sometimes I want to make an appointment to see her. Yeah, we just enjoy doing what we're doing, and that keeps us pretty busy. You know, I missed all of you last week. I couldn't come on the air. I was a little behind in the things I had to get accomplished. Because some of you know, I do this program live from the Down East Nursing Home in Gates County, North Carolina. So I break from seeing patients and I come on live, and we do our program and go back to seeing patients. And our goal is always something preventive health. What can we give you? What kind of information can we share with you that you can use right now, immediately, bar none, and just begin to immediately have the success of using that information? And that's our goal.
Yeah.
Whenever we do a program, that's our goal. The last time I was on, we started talking about the Mediterranean diet. We talked about weight loss, weight management, and we talked about calories and proteins, carbohydrates, fats. So we're kind of just continuing along that line and trying to fill in some of those gaps that we may have missed along that way. Now, when you talk about the Mediterranean diet, there's nothing mystical or magical about that, but that's the term I often use when I'm talking about eating healthy. And why do I use that? There's other eating healthy ways for sure. I'm by no means trying to suggest that that's the only way. But there's been a lot of research done in relationship to the Mediterranean diet. So when you're talking from a medical point of view, we like to be able to talk about things that have data that back it up.
Okay.
And the Mediterranean diet is probably one of the most studied diets in the whole world and has some great associations with it. That's why we choose to talk about that. It has some great benefits in cardiovascular, benefits in hypertension, benefits in peripheral vascular disease, benefits in diabetes, benefits in Alzheimer's disease. So all of these are areas that have been studied extensively, pretty much, with the Mediterranean diet in different parts of the world. Anyway, call it different, but the combination of foods that are and ingredients that we're talking about, we'll get back and get into in a minute, but those are the things that make it called the Mediterranean diet. Is the combination of foods that you put into that equation.
Okay.
And I'm not talking about diet per se, I'm talking about the way in which you eat.
Yeah, that is a difference.
Yeah, there's a difference. And I always encourage people not to go on a diet, but to have lifestyle changes. Because if you have lifestyle changes, then your diet and your weight loss, your weight management will come into check, just based on you having those lifestyle changes. Diets are not a great thing because they have an end point. We want you to be healthy for your life. We don't want you to go on a 2-week diet, a 6 months diet, or however long you choose to do it, and then once you're done with the diet, what do? You're back into your previous routine.
Yeah.
And what did your previous routine get for you? Overweight, hypertension, diabetes, kidney disease, liver disease, lung disease, etc. So we're not after you taking a brief hiatus from doing something bad. We're after you having lifestyle changes so that you do something good for the rest of your life. Does that make sense?
It makes a lot of sense. It makes a lot of sense. Other than just like you mentioned earlier, just dieting. A lot of those diets look just like fast.
Right.
Some people that just want to lose a certain amount of weight for a certain particular an event, and after that, they're back to their old style.
Exactly. So this is why we work on trying to get people to change their mindset. If we can get you to change your mindset, then we can have success. We can get you not to have a poverty mindset, then you're no longer going to be in poverty. We can get you to have a wealthy mindset, then you're going to be wealthy whether you've got cash flow or not. It's a lot of this is about the mindset, and you need to have the right mindset. You need to get rid of those words like can't and try and but. Those are 3 negative words that hang out together. A person says, I would have lost weight, but I had to go down to see my husband at the hospital. I would have lost weight, but I didn't have all the food at the house that I wanted. I would have lost weight, but my exercise machine was broken. So you can see how when you put the word but in there, you often eliminate what's in front of that but. That would have been a good thing. And then the can't and try, they hang out together. They're best buddies. Somebody says you're going to try to stop by your house next week. What does it mean? Somebody's going to try to make you a cake on your birthday. What does it mean? You may not get it. Good chance you may not get it. So I call can't and try best buddies. So you're going to try to lose weight. You're going to try to eat better. You're going to try to get better sleep. Well, chances are it's probably not going to happen. And when you get in a doing mode, this is what I'm going to do. It's got a much more positive overtone to it.
Especially when it comes to one's health, and especially if one's caregiver, the doctor has said you need to do this, you need to do that. There's no need to try, but go ahead and do it.
Absolutely. And so if that's one of the major things I spend a lot of time with my patients, is trying to get them out of the out of the trying mode, but into the doing mode. And people don't understand the huge difference in those 2 little words. It sets the whole course for how you're going to do something. If you're trying to do something, if you're doing something, and that sets the course on how it's going to flow. And so I strongly encourage people to get rid of those 3 words: but, can't, and try. Negative words. So we're talking about the Mediterranean diet and how does it relate to healthy eating. Well, it relates to healthy eating because the ingredients, the foods in the Mediterranean diet, my mouth is getting a little dry, I had to add a mint. The foods in the Mediterranean diet are are largely high in antioxidants. They're high in cancer prevention and cancer fighting agents. They're high in vitamins and minerals. All of these things you need for your body to function normally. Your body has to have water, it has to have nutrients. And I always start with water because that's the most important part. Men 65% water, women 55% water. Bloodstream 82% water, muscles 75% water, even your bones 25% water. So you can see that water is a critical part of our lives. And if you don't drink enough water, you're out of balance. It doesn't matter whether you like it or not. And you can't just drink water in the summertime. You have to drink water all year round. Your body is existing all year round, not just in the summertime.
That's right.
A lot of times people say, oh, in the summertime, I don't have no problem with water. But in the winter, I don't like water. Well, it's nothing to do with like, it's all to do with what's good for you. So water, again, is the biggest and the first point on the Mediterranean diet is drinking plenty of water. Very, very important. What's next? Next on the list is let's look at the pyramid again, and then we'll get into some more details. If you picture in your mind a pyramid, you call it the pyramids in Egypt, the pyramids of old, or just pick a triangle if you can't see a pyramid in your head. So you pick a triangle. At the top of that triangle is, we're going to use that to describe the Mediterranean diet. So the top of that triangle, a few times a month, are red meats, and right beneath that is sweets. So sweets and red meats a few times a month. A lot of times in the Mediterranean diet, for a snack, a person might have a piece of cheese, maybe a cracker and cheese, as opposed to the Western snack, which we're going to have ice cream, we're going to have cake, we're going to have pudding, or cookies, something that's a lot more sweet and a lot more fattening. And then next on the Mediterranean diet are eggs, and that's a few times a week. Eggs and chicken, a few times a week. Now, people often say, well, eggs are high in cholesterol. Well, they are, but every cell in your body has cholesterol, and you have to have cholesterol. The key is to have a balance. So you can't, some of the fat that you take into your body will get converted into cholesterol, and that's in the negative category. But the saturated, when you talk about animal products, that's where they bring you saturated fat, and some of that saturated fat will also be a source of cholesterol. But cholesterol is important. Every cell in your body has cholesterol in it. So we have to have cholesterol, but you want the right amount. You want a high amount of HDL cholesterol and a low amount of LDL cholesterol. Now, how do you get to those different proportions? You get your HDL up with exercise, you get your LDL up by cutting back on your sweets and your fats.
Now, those listening may be asking, now, what's the difference between those two?
Well, when you say cholesterol, cholesterol is made up of multiple different components. And there's much more to it than what I just said. There's particle size, which makes a big difference. But for the average person to try to understand that, we may be getting a little further off the track. So just as to understand, you have, let's go real simple. You have your total cholesterol, and let's say simply that's made up of your good cholesterol and your bad cholesterol. So now we got two components to our total. Now it's actually more than this. I'm definitely oversimplifying this. For any of you who are listening and have a more sophisticated understanding of this, understand I'm oversimplifying this to help our listening audience have a better understanding of cholesterol. And so you have your cholesterol, you have your good, and you have your bad. Your good is called your HDL, high density lipoprotein, and your bad is called your LDL, low density lipoprotein. Now you want your HDL to be greater than 60. That's your good one. And that gets up with exercise. So the more exercise you do, the better you're going to do with your good cholesterol. Now you have your bad cholesterol. We like that to be under 100, sometimes under 70, but for sure under 100. Now, how do you get your bad cholesterol down under 100? You got to watch the sweets, and you got to watch the fats. So those are the two big components. Now, a lot of people have heard of statin medications. They're utilized to help bring the cholesterol in check, and that's from a prescription point of view. That's the best thing probably out of the statin medication. From a natural point of view, I use a product called BioSlife, and BioSlife has 2 patents to lower the serum cholesterol, and it goes and works on the cholesterol by 4 different mechanisms of action. One of them is pulling some of the excess cholesterol from the GI tract. And what I get with that are really good results, very similar to what you get with the statin medication. We get an increase in our HDL by about 30%. We get a drop in our LDL by about 30%, which is actually a very huge numbers, and most prescription medications can't come close to meeting those numbers. So for those of you who do have more interest in your cholesterol, go by my website, which is well, actually go by YouTube. My website or YouTube. There's a video that I didn't produce it, but it's a real good video that explains and describes how BioSlife works. I think they call it, I think it's under the name of Slim. but it talks about cholesterol and it talks about blood sugars. So if you go to my YouTube site, youtube.com /user/Ask Dr. Ferguson, and click on my favorites, you'll see a YouTube that talks about cholesterol and diabetes. If you go to my website, and I don't remember what it's at on my website, but somewhere on my website there's a video that also talks about this cholesterol and diabetes issue. So a big issue, and getting a better understanding of it would always be a good thing to do. Was that relatively clear, Bishop?
Yes, it was. I say yes because I've read it before now. Right. But it should be easy to understand both.
Okay, so again, now I had a person in my office just this week. She said she went to a health fair and they told her cholesterol level was high. Well, that's difficult to assess when you just have one total number, because that total number could be made up more of your good cholesterol, which would make a high total number a good number. When you talk about the total cholesterol, we usually refer to being under 200.
Okay.
But if your total cholesterol is made up of 150 of your HDL and it only has 85 of your bad cholesterol, and you add those together, and actually there's more to it that you add to that. So say you add those together plus a couple others are in there, say now you're at 250. So you look at the 250 number and say, oh, your cholesterol's high. Well, really, that's a really good cholesterol because the HDL was so high. So in all I get an understanding, and when you go to a health fair and you get the total cholesterol, that may mean something bad. It may mean that things are okay. And the example I just described you, that will be a great cholesterol number to have. So in all I get an understanding. So we're talking about the Mediterranean diet. We're still at the top of the pyramid. So just a couple times a month, having red meats and sweets. And then underneath that, you're having eggs 2 times a week. You're having chicken 2 times a week. If you're going to have the chicken, fish, and turkey, baked, broiled, steamed, or grilled, not fried, pull the skin off. That's where most of the fat is. And next on the list would be fish. Fish is 5 to 7 times a week. One of your good fishes, your cod, your mackerel, your salmon, your herring, but not the herring that people eat many times in the South where they salt it, but fresh herring. So those are some good fishes to eat. There are others, but those are a good list to start from. And they have omega-3 fatty acids in them, which is a very good product for us to have in our body. It does many, many things for us, such as decrease incidence of heart disease, helps with cholesterol profile we were just talking about. We think it may also help some with Alzheimer's disease. So there's a lot of studies have been done on omega-3 fatty acids as well. And when you're eating fish, you're getting that from the skin. So unlike the chicken, fish, and turkey, where I say don't eat the skin is where your omega-3 fatty acids are found on the fish, and that's a good fat for you. But again, everything in moderation. Anything in excess ends up being a problem.
Yes, indeed.
Now, we're still talking about the Mediterranean. Now we're about to the middle of the pyramid. So if you think about a triangle, go about down to the middle of it. In the middle of the triangle, you're going to have cheese and yogurts. So cheese and yogurts are something they do on a daily basis. And then beneath that, you're going to have olive oil. Olive oil is used as for cooking. It's used as a salad dressing. It's used just all over the place. If you're going to get the olive oil, I suggest you get the extra virgin olive oil. That's the one we think is the best. If you read the Bible, you'll find that whenever they talk about an oil, they almost always are talking about olive oil. So olive oil is probably the best oil we know of. Canola oil is also a good monounsaturated oil. Then after that, you have polyunsaturated oils. Those would be your plants and vegetables. And then you have the saturated oils. Those will come from your meats. So we're talking about the Mediterranean diet. We're working our way down the pyramid in the way proportions of these types of foods you should have on a daily basis, weekly basis, etc. Now underneath the olive oil, you have the fruits, you have the vegetables, you have the beans, and the lentils. So those will be towards the middle of the pyramid. Not the middle, we're getting towards the bottom. We're one layer from the bottom now. These are things that you have several times a day, not just once a day, but several times a day. And then at the bottom of the pyramid, you have your pastas, your rice, your dark green, your dark, crusty types of breads. Your breads, you want it to be dark and crusty. Those are usually more higher in nutrients. You don't want them to be white. Any of your foods that are white have usually been bleached. And what happens when you bleach the food or bleach anything? What happens when you bleach your jeans? You pull the color out. That's what happens when you bleach the food. You pull the nutrients out. And then man in its infinite wisdom will fortify that particular food. So what do you do when you fortify something? If you had a fort and you were fortifying, what would that mean? You'd make it stronger. You would try to prevent anybody from getting in when you fortify something. So now, when you fortify that particular food that you just bleached, you fortify by putting nutrients back in, you put the vitamins and minerals back in. That's if you could get it exactly correct the way it came out, of which you can't. So our best guess is to try to get more vitamins and minerals back into that particular product. And that's what it means to fortify. So first, if you pick up a loaf of white bread, many times it will first say bleached wheat flour. Well, why do you want to take my ingredients away? Why do you want to take my nutrients away? And then the next item, or 2 or 3 down the road, might say fortify with, and then it will tell you the different vitamins and minerals that are put back into that particular product. So my suggestion would be to you, don't take the ingredients out in the first place and then try to put them back. Right. There's no way can we make it better than God made it in the first place. So all of you who are talking about they're not eating bread, not eating pastas, not eating the rices because you dieted and want to lose weight, but your body needs nutrients. About 30% protein, 30% carbohydrates, 30% fats. That's not entirely accurate because you can see it only adds up to 90%. But it's a rough estimate. It's a guess. It's a place to get started from. Your body needs all of those things. It needs carbohydrates. It needs fats. It needs protein. You can't just do one without the other. You'll become out of balance. And we're always talking about being in balance. So when you talk about the Mediterranean diet, you want to talk about a healthy way of eating. That's the only thing we're talking about. Some people might refer to it as the Hallelujah diet. Some people might refer to it as the Middle Eastern diet. Some people might refer to it all different kinds of ways you can refer to it. The bottom line is we want you to have nutrients that are consistent with the kind of nutrients we find in the Mediterranean diet. I told you all early on that it's high in antioxidants. Well, what's an antioxidant? An antioxidant is usually going to come in the form of a vitamin or a mineral, and it's going to bring an extra. It's the repair group. It's going to come into your body and it's going to repair what we call free radicals. Now, free radicals are cells that are functioning abnormally, and they lose what we call an electron. So, put it simply, you got an orange that has 2 ears, and now you've lost one of the ears. And so now what happens is the antioxidants come in the form of the fruits and vegetables that you're having for your Mediterranean diet, and it brings an ear back and replaces the ear that was lost on that orange. So now that orange is a normal, functioning, healthy orange again, where when it had lost that one ear, now it's called a free radical and functioning abnormal. And free radicals are going to be triggers for cancers. Cancers take probably 5 to 8.5 years before we can detect them in any shape, form, or fashion. So when you get some abnormal cells in the body and they begin to divide abnormally and so forth, you got 2, you got 4, you got 8, you got 16, you got 32, you got 64. And so it just keeps dividing and dividing from the one cell level, and it's dividing abnormally because it started out abnormally. So you're creating a whole group of cells that are abnormal, and that whole group of cells that are abnormal, and now you've got a nidus, now you've got a trigger point for developing a cancer. And so why do we need preventive health? For just that reason I just described to you. Because it takes 5 to 8.5 years before you can pick up a cancer in any shape, form, or fashion. What does that mean? That means that that cancer is growing inside of you a long time before we pick it up in any shape, form, or fashion. So how do we try to prevent that cancer? Eating healthy, proper sleep, proper water, and we'll never know how successful we were in preventing something until many, many years down the road. Does that make sense?
Yeah, I was about to say, but it makes good sense. So what we know, number one, is to make sure we get good from our health providers regularly.
Absolutely. So many patients come in very irregular. I had a patient just a couple of days ago. Came in, blood pressure was sky high. Patient hadn't seen me in a couple of years. Wasn't taking her medication. That's a frequent occurrence that I get in the office. And so I encourage you, those of you that are listening audience, and those of you on the World Wide Web, when your doctor or healthcare provider makes a suggestion to you, try it out. If they put you on medicine, if you're not going to take the medicine, go back and talk to them, ask them, is there something different you can take? Is there another kind of medication you can take? But don't just stop taking it and don't going back to the doctor or your healthcare provider. Stay in there with them. Hang in there with them. Those of you who want to get more information about the kind of things I'm talking about and frequently talk about, you can always call my office at 252-332-6484. We're happy to see new patients. We see new patients all the time. You can go by my website, askdrferguson.com. A lot of preventive health tips and nutritional supplements I have there on the website there to help you. Those of you who want to know more about things like Alzheimer's disease, I've got a lot of YouTubes on Alzheimer's disease. Substance abuse, I've got a lot of YouTubes on that. So if you go to youtube.com/user/AskDrFerguson, you'll be right there on my website. And then just click and view some of those videos and share them with a friend. So I also have an area called Passion Cam, and under the Passion Cam, I just have some type of video that's positive. It could be on substance abuse, it could be on parenting, it could be on grandparenting, it could be on just about anything, but it'll be a positive note. I made a decision early on that whenever I did my Passion Cams, I just put my video camera on my dashboard while I'm driving. I just talk right to the camera, put my hands on the wheel, and just talk while I'm driving. But I made a decision early on, any Passion Cams would be something positive, something uplifting, something to help a person feel better about themselves.
Now, for those who listen to this morning, they may be wondering, do you have a chart of the Mediterranean diet on your website?
I do. If you go to my website and you go to Frequently Asked Questions, FAQ, at the top of the page, you click on that, and you'll get a drop-down menu. In that drop-down menu, you'll find the Mediterranean diet. It's just an outline. It's a sketch. You can type in Mediterranean diet in your Google window or in your browser on your computer, and I'm sure it will take you to multiple places where you can find the Mediterranean diet. So there's no monopoly on the Mediterranean diet, and anybody can do it.
Yeah, and I think it's also that you can find it on the food pyramid.
Yeah, absolutely. The food pyramid may have the food in there according to the Mediterranean diet. That's why I do have it on my website. I have a food pyramid on my website, but the food pyramid that's talked about in local dietary circles is not the Mediterranean diet.
Oh, okay.
So people can take the food pyramid and they can put their different foods in it and change it around a little bit. It used to be the 4 food groups on that pyramid. When I was in the elementary school, I remember that pyramid was divided into 4 parts, and it supposedly had pictures and examples of the 4 food groups. Well, I would suggest to you there's a lot more in the 4 food groups, and that's why I think the Mediterranean diet is a good outline for you to utilize in, preparing your foods and going shopping, etc.
Well, we got about 90 seconds.
Okay. Well, again, I always want to let people know they can call the office. If you have questions or concerns, call the office, let them know. Stuff you want me to talk on the air, or you may just want to see me as a patient. We still do a lot with natural hormone therapy, erectile dysfunction, do a lot with Alzheimer's disease, a lot with weight management, weight loss, and then we have the regular traditional practice. So you can always reach us at 252-332-6484. You can go by the website, askdrferguson.com. You can go by youtube.com/user/AskDrFerguson. To get everything I said to you today, just type Ask Dr. Ferguson, AskDrFerguson, in the browser, and you'll pull up many pages where I have different things on the internet.
Okay.
All right, well, be blessed and have a wonderful day. Bye-bye. So we've left our radio audience. Now we're just live on YouTube. For those on YouTube, I also want to not let you forget to go by my photo website. My photo website is photo, PHOTOMEDOC.com. And that's my photo website. On the home page are stock photos. And then throughout the body, if you go to browse, you'll find lots of other videos not videos, but lots of other photographs that I've done over the years and over time period. So on that note, to the World Wide Web, our listening audience, we appreciate so much coming. Tell your friends about us. Come back and join us again. every week, 9:30 to 10. All right. So on that note, you all be blessed.